Well, if you are looking for a more discreet way to straighten your teeth, Invisalign, well, just might be the answer that you're looking for. A-Plus Dental Care aims to provide the dental services you need at every stage of life. And here to fill us in is A-Plus Dental Care Managing Partner, Dr. Tim Herman. Great to have you back on the show, my friend.
Thank you. Well, I'm glad to be here.
Okay, so tell us, what exactly is Invisalign?
Invisalign is new age orthodontics. It is computer-assisted design and manufacturing to produce clear aligners that can move your teeth from where they are to where you actually want them to be. And there's a little simulation on the screen now to take the teeth from, like I said, where they are, and the aligners are virtually invisible, so you can wear them and nobody knows you have them on. And you can see where the tooth here is tucked back in and slowly moves out. Wow. And then in a matter of months, changing the aligners on a weekly basis, the teeth move, and you can take them off to brush and floss, keep your teeth clean. It is really a great way to do it.
Okay, and then what is an iTero scanner?
iTero scanner are digital scanners, so that replace the disgusting impression material that people really complain about. So no more gagging on impression materials, because we actually have a digital scanner.
That's so nice to hear.
That scans the teeth. And actually, if you want to come in for a free consultation, we can scan your teeth, and in about 5 minutes, we can simulate what your teeth would look like.
Wow.
Using Invisalign.
Okay, yeah, and here's a before.
Yes.
Okay, and then we're also going to show an after. So what are we looking at on the before versus the after here, doctor?
So before you look at, these teeth are a little harder to see, but when they turn it up, you can see that the teeth are a little crooked, and then when we move to the following ones, that they'll be all straight and aligned in a nice arch form, which is much more stable for your teeth.
Okay, and then I know you'd mentioned, if you've ever had to deal with impressions, the putty material that they put, you do gag, and especially if you have younger individuals, it can be a little difficult. So fantastic to hear about that iTero scanner.
Yeah, the scanner is great.
Yeah, okay, and also tell us though, if someone has relatively straight teeth, would they also consider Invisalign?
Yeah, if you just have minor movements or minor corrections, you had braces when you were younger, maybe there's a little rotation happening, or that you're getting wear on your teeth. So your teeth, yes, they are straight, but they're not really connecting correctly. And so getting them connecting correctly, better long term. And so yes, you can use Invisalign.
Okay, and why Invisalign over braces?
For most adults, it's because you don't walk around with braces. You don't have metal mouth. You don't. But it's also can be faster. It's easier to keep clean.
Oh, really?
You can work and talk, and you could even do your job with the aligners in.
And people would never know.
People would never know. You've got beautiful teeth, but you don't need it. But yes.
That's because I've been through a lot of orthodontia. That's why I know about the impressions.
Yes. You've been through that.
I've a number of times, yes. And so have my children as well. So some people, they've been through braces, and perhaps their lower teeth are still kind of crooked. Would Invisalign, like you mentioned, be able to help with that?
That's really what we're seeing a lot, because a lot of people were not told to wear their retainers forever.
Yes.
And really in orthodontics and in dentistry, we talk about retention forever now. It used to be, oh, wear your retainers for 2 years and then throw them away. But teeth continue to move. There's constant remodeling of the bone. So when those teeth get crooked, getting them straightened out is a great thing, so that you can keep them clean, and clean teeth don't get cavities, don't get gum disease.
And that's also great too for younger ages as well. I know I actually had my daughter at a very early age have to go through the braces for an underbite. And my concern was, would she be able to keep up with the cleanliness?
Yes.
Nice to know Invisalign, though, could be an option for her second round of orthodontia.
It depends. They're even starting to do Invisalign for that first round of orthodontics too.
Okay, and what are some of the other reasons that someone might want to use Invisalign?
Well, if you're getting gum recession, can be because your teeth aren't aligning correctly. You're getting grooves at the gum line. Edges of your teeth are cracking. You're getting a lot of fracture lines in your teeth because they're just not coming together. Getting them aligned and using the Invisalign process is a simple way to do it.
Okay, and what would you say is the average age for Invisalign?
Well, it used to be, I would say, probably mid-30s, because people were going back into braces of some sort. But now with latest technology, they can start them as early as probably 10 years old, and all the way up to, I think our oldest patient we've done Invisalign on has been 85.
Wow, okay. So pretty much almost anyone, right?
Yeah.
And why do you recommend that people go to a dentist like A-Plus Dental to get this done versus some of the online stuff that we see where you can get those Invisalign trays for relatively cheap?
Yeah, so if you get it online, they're not Invisalign trays. They're different. They're not the same brand. And they can align the edges of your teeth, but it doesn't mean you're going to get a nice aesthetic result. And so the most important thing in aesthetics is the relationship of the upper incisors to the upper lip. And only a doctor can coordinate that and improve that.
Yeah, you don't get an iTero scan done over the internet.
No, no, you don't.
Okay, and you have a special offer for everyone.
We do. Through the month of June, we're going to have a $500 off the full Invisalign case. And we always do no-charge orthodontic consultations. So if you're concerned, think you might want to do it, give us a call and we'll absolutely get you in and do that.
And where can people go for more information?
You can go to our website, it's aplusdentalcaregroup.com, and or give us a call at 916-784-1144.
Dr. Herman, always a pleasure to talk to you.
My pleasure.
Thank you so much.
Thank you.
This interview involves commercial content. The products and services featured appear as paid advertising.